Doctors sometimes choose to use robotic surgery to shorten a patient's recovery. Well, Dr. Jennifer Gilby from Women's Care Florida is here to explain the benefits of using this surgical option. Welcome to the show, Doctor. How are you?
Thank you. I'm very good. Thank you for having me.
I'm excited to chat with you because I think robotics and surgery is something that you hear about in the headlines, and maybe it's kind of a term you say, like, yeah, that sounds good, but you really don't know a lot about it. So what are you seeing in your practice these days, and how is it helping patients?
Well, I think that robotics initially got approval for gynecology, for GYN, in 2006, and I jumped on the bandwagon early on, and I feel that what it does for us as surgeons is it really provides a lot of mobility. Laparoscopic cases are more archaic in a way. I mean, the instruments are very limited in their mobility. You know, they can rotate and they can articulate, but they don't have 360-degree motion, whereas that's what you get in robotic surgery. And I think what patients or what people need to understand about robotics is it's not a robot doing the surgery.
Yeah.
The robotics is augmenting our laparoscopic technique.
Okay.
And so what that means is that it allows ease of surgery in that arms are used under our control. It requires less of us ergonomically because traditional laparoscopic surgery requires two people at bedside, and even at that, you're kind of contorting your body to get into certain positions, moving the table, doing different things, whereas the robot does all of that for you. And so it allows you to get into smaller spaces. It allows you to zoom in. It allows you, like I said, the freedom of as if your hands are in there in an open case. So it's it provides much more flexibility in the case. That's from the surgeon's perspective. Yeah. From the patient's perspective, I think that it shortens the case time for really difficult cases. So of course, shortening the case time shortens anesthesia, shortens, you know, the recovery period. In comparison to true laparoscopy, the difference would be that, you know, most of the time surgeons can do it faster. It is still the same ports, it is still, you know, the same technique, it's just slightly different instruments. Where it really is beneficial is in cases that would be normally open. So if you were couldn't do the case laparoscopically because of the difficult technique or the difficulty of the procedure, and the patient was facing an open procedure, that would mean 2 to 3 day hospital stay, you know, definitely 6 weeks out of work, and, you know, not driving for 2 weeks, and a lot of differences in pain and recovery, whereas the robotics takes that patient as an outpatient, puts them under anesthesia. Oftentimes they go home the same day, and they're really feeling very good at 7 to 10 days, you know. So it's in the difference of, could I do this case, you know, would I have to do this case open, or can I actually do it robotically because it's so difficult? And that's really where the huge benefit of robotics comes in.
Yeah, I mean, I'm already like hooked. What are some of the procedures, though, that you do see are benefiting? What are some of the diagnoses that patients may receive that this becomes an option for?
So there's 3 or 4 really large cases that we tend to, you know, lean towards robotics with. Along the there's prolapse cases that we do that are called sacrocolpopexy, very long word, that repairs prolapse. There are myomectomies, so if they have fibroids, you know, large fibroids that would otherwise, you know, not be able to be done laparoscopically. And then there are hysterectomies, of course, where the patient has very large uterus, and manipulation traditionally in laparoscopically and traditionally is more difficult, getting into the spaces, seeing where you need to go, and being able to mobilize the uterus to get to the vessels that you need to get to. So, and then the last one is endometriosis. There's a lot of really high-tech ability to resect the lesions of endometriosis using the robot. And so, I feel that we also can use some different imaging with the robot, which can light up endometriosis implants that we don't have in traditional laparoscopy.
Well, maybe you're facing surgery for yourself or have more questions or have any questions under the Women's Care Department. Well, of course, you can go ahead and reach out to any of these fabulous doctors. If you have any questions for yourself, womenscareflorida.com is the website, and there you see on your screen. Thank you so much for coming in and talking about this.
I appreciate it.